Lesson 10. Stress, the main trigger of mental and physical illness. Stress is one of those words that sound trivial in everyday language. We say we have stress, live in stress, can't cope with stress. Yet in medicine, stress is not a casual term but one of the most important risk factors for illness, both mental and physical. The WHO and all modern psychiatric guidelines emphasize that chronic stress affects the brain, heart, immune system, hormonal balance and patterns of thinking far more than most people realize. In psychiatry, there is no doubt today, stress is one of the most powerful triggers of psychotic episodes, depression, anxiety disorders, suicide attempts and most relapses of schizophrenia. The greater a person's biological vulnerability, the stronger the impact of even seemingly minor stressors. Studies show that in people with schizophrenia the nervous system reacts to stress more abruptly, returns to baseline more slowly and more easily becomes overloaded. This means that what would cause only tension in a healthy person may, in someone who is ill, lead to disorganized thinking, anxiety, insomnia, and even a relapse of psychosis. But stress does not end with the person who is ill. It also affects you, the caregiver, and often in a quiet, gradual way, harder to notice than in the person with the diagnosis. Caring for someone with a mental disorder is one of the most demanding life experiences. It requires constant vigilance, readiness to respond, anticipating problems, dealing with uncertainty and bearing responsibility. All of this creates an environment of chronic stress which, if unrecognized, can lead to emotional burnout, anxiety disorders, depression, insomnia, hypertension, metabolic problems, and even nervous exhaustion. That is why this lesson is not about stress in general, but about stress as a real force that affects your loved one's health and your own. I want you to understand how stress acts on the body and why it has particular significance in schizophrenia. I also want you to see that your own tension, fatigue, and exhaustion are not weakness, but a natural result of long-term overload, something that must not be ignored. Stress and the brain. To understand why stress has such a strong impact on mental illness, you first need to know what stress does to the brain. Contrary to appearances, stress is not just a feeling of tension. It is a state in which the brain begins to operate in a completely different mode. It receives stimuli differently, interprets them differently, and controls your reactions in a different way. In practice, this means that a person under stress does not think or behave in the same way as when they are calm, and there is nothing strange about that. It is biology, not psychology. The key role in the stress response is played by the limbic system, the structures responsible for emotions, the sense of threat and instinctive reactions. When stress increases, the limbic system starts to dominate other parts of the brain. Irritability, anxiety, agitation, and sometimes overinterpretation of stimuli appear. A brain overloaded by stress more easily sees danger where there is none and has more difficulty distinguishing real signals from imagined ones. At the same time, the prefrontal cortex, the part of the brain responsible for assessing situations, logical thinking, planning, and impulse control, becomes weakened. In practice, this means that under stress it is harder to concentrate, easier to make mistakes, irritability comes faster, and decisions become more impulsive. Many studies show that chronic stress literally reduces the activity of the prefrontal cortex and, in extreme cases, can lead to structural weakening. This is why people living under chronic strain often say they can't think straight, lose their patience, or don't recognize themselves. Stress also affects the hippocampus, the structure responsible for memory and learning. High cortisol levels make it harder to encode new information and impair the ability to recall events. This is why, under stress, people lose things, forget, and struggle with organizing their day. It does not come from their character but from brain chemistry. It is also well documented that chronic stress reduces hippocampal volume, which affects cognitive functioning even in otherwise healthy individuals. All these changes mean that stress is not just an emotion. It is a neurobiological state that alters how the entire brain works. A person under stress has less access to calm, rational thinking. They react more strongly to emotional stimuli, interpret situations as difficult more quickly, and their body needs more time to return to balance. These mechanisms operate in everyone, but in someone with schizophrenia their importance is multiplied. In schizophrenia, regulation of emotions, concentration, and perception is already weakened. If stress is added on top, the brain becomes even more vulnerable to overload. This is why small changes in the environment, time pressure, conflicts, noise, fatigue, or too many stimuli can provoke reactions that would seem disproportionate in a healthy person, but in someone who is ill lead to chaotic thinking, irritability, anxiety, or complete withdrawal. By understanding these neurobiological foundations of stress, it becomes easier to see why stress so quickly activates psychiatric symptoms, interferes with treatment, and why a person with schizophrenia functions better in an environment that is predictable, calm, and orderly. This is not a question of character, it is a question of how the brain works. Stress as a trigger of mental illness. If you want to understand why stress is so dangerous for mental health, you need to know that most mental disorders do not appear out of nowhere. People rarely develop depression, anxiety disorders, or psychosis solely because of their genes. It is usually stress that acts as the trigger. The vulnerability may be present for years, but only chronic overload, loss of control, intense emotions, sudden life changes, or prolonged pressure start the illness process. The diathesis stress model, widely used in modern psychiatry, is clear: for many mental disorders to manifest, both biological vulnerability and stress are needed. You can picture it like this: predisposition is the spark, but stress supplies the oxygen. The greater, longer, or more chronic the stress, the higher the risk of an explosion. This is most clearly seen in depression. Long-term stress changes the action of neurotransmitters, disrupts serotonin and dopamine levels, weakens the functioning of the prefrontal cortex, and increases the activity of the limbic system. In practice, this means that the brain starts to work in a more emotional and less reflective way. Dramatic events are not required for this process to begin. Prolonged pressure, overload with responsibilities, feeling trapped, long-lasting conflicts, or, for many caregivers, months of living in constant readiness and tension are enough. This is why depression is one of the most common consequences of chronic stress, regardless of the person's life situation. The same is true for anxiety disorders. When the body lives under strain for a long time, the limbic system becomes overactive. Anxiety, irritability, muscle tension, and difficulty maintaining calm attention appear. A person begins to respond with fear to stimuli that previously were neutral. They stop trusting their own assessment of situations. They start sensing danger where there is no real threat. This is not oversensitivity of character. It is the result of biological changes caused by stress. Stress is also one of the most important risk factors for psychotic disorders, including schizophrenia. Long-term studies show that people exposed to chronic stress, especially during adolescence and early adulthood, have a higher risk of experiencing a first psychotic episode. Moreover, stress is the main trigger of relapses in those who are already ill. This is why even seemingly minor situations, such as a change in routine, family conflict, too many stimuli or exhaustion, can cause disorganized thinking, insomnia, anxiety, or an intensification of delusions in a person with schizophrenia. Their nervous system is more sensitive to these stimuli and returns to balance less easily. It is also important to remember that chronic stress increases the risk of using psychoactive substances. Alcohol, cannabis, legal highs, or illegally obtained tranquilizers often become ways of calming down the tension. Unfortunately, this path leads to addiction and sudden deterioration of mental health. In clinical practice, we see that many relapses of schizophrenia occur precisely when stress pushes the person to reach for substances that bring short-term relief. In summary, stress is not a minor inconvenience of nerves that can be ignored. It is one of the most powerful triggers of mental illness, both in people who have never been ill before and in those already living with a diagnosis. The better you understand how stress works, the easier it becomes to notice those moments when tension is crossing the boundary of safe tolerance. Stress as a cause of physical illness and weakened immunity. When you think about stress, you probably associate it mainly with mental strain, haste, emotional exhaustion, or fatigue. Yet from a medical point of view, stress is one of the most important factors affecting the health of the entire body, not just the mind. Modern medicine treats chronic stress as seriously as smoking, lack of exercise, or an unhealthy diet. It is not an add-on to illnesses. It is a real, biological cause of them. Chronic stress keeps the body in a constant fight-or-flight response. The heart works faster, blood pressure remains elevated, breathing becomes shallow, and muscles stay continuously tense. The most important factor here is cortisol, the stress hormone which, in the short term, helps us survive difficult situations, but in the long term disrupts the balance of the whole system. Raised cortisol levels lead to increased blood glucose, greater accumulation of visceral fat, lipid disorders, and hypertension. This is why people living in chronic stress have a higher risk of heart disease, type 2 diabetes, and abdominal obesity. Stress also has a dramatic impact on the immune system. Cortisol weakens the body's ability to fight infection, impairs lymphocyte function, and disrupts the balance of inflammatory responses. As a result, a person under stress becomes ill more often, recovers more slowly, and tolerates even minor infections poorly. Studies show that chronic stress increases susceptibility to viral, bacterial, and fungal infections and worsens symptoms of chronic diseases, from asthma to autoimmune conditions. This is why many people say they get sick as soon as they relax a little, only then does the body allow itself to reveal what was being suppressed during the stressful period. Stress particularly affects the digestive system. High cortisol levels disrupt the secretion of digestive enzymes, slow down or speed up intestinal peristalsis, trigger inflammation, and increase gut sensitivity. For many people, this leads to symptoms such as abdominal pain, diarrhea, constipation, nausea, or reflux. In extreme cases, chronic stress can contribute to conditions like stomach ulcers or irritable bowel syndrome. This is no coincidence. The nervous system and the intestines are directly connected by a network of nerves, and the gut often reacts to stress faster than the brain. We also cannot ignore the effects of stress on sleep. Cortisol disrupts natural sleep cycles, shortens deep sleep, causes nighttime awakenings, and makes falling asleep more difficult. Lack of sleep, in turn, raises stress levels, creating a vicious circle that is hard to break. Chronic insomnia is one of the most destructive consequences of stress because it leads to cognitive problems, low mood, irritability, reduced immunity, and increased susceptibility to infections. It is also worth remembering that stress makes existing physical illnesses worse. A person with hypertension reacts with higher blood pressure spikes. Someone with diabetes experiences more difficult to control glucose levels. A person with cardiovascular disease is more exposed to complications. Stress does not only trigger illnesses, it also exacerbates them. This is why many medical guides emphasize that patients with chronic diseases must be especially mindful of their stress load. When you look at stress this way, you begin to see that its impact is not limited to how you feel. Stress changes the functioning of the entire body, from hormones and the nervous system, through immunity and digestion, all the way to heart function and metabolism. This is why chronic stress is one of the most important risk factors for physical illness. And this is exactly why, in caring for a person who is ill and in looking after your own health, you cannot afford to ignore it. Why people with schizophrenia react to stress differently. To understand the behavior of a person living with schizophrenia, you need to accept one key rule: stress that is just difficult for you can be overwhelming and unbearable for them. And this is not about a weak psyche, but about a completely different way the brain functions. Modern psychiatry, based on the diathesis stress model, states clearly, in people with schizophrenia the response to stress is stronger, more abrupt, and harder to calm than in people without the illness. This results from several overlapping biological mechanisms. First, the limbic system, which is responsible for emotions and detecting threat, is significantly more reactive in people with schizophrenia. Imaging studies show that the amygdala, the brain center for processing emotional stimuli, reacts more strongly to stress, even when the stressor is minor. This means that the person feels tension more quickly, is more likely to interpret a situation as dangerous, and their emotions are triggered more intensely. What for you may be a small thing can, for them, be a stimulus that sets off a full-blown anxiety response. Second, the prefrontal cortex, the part of the brain responsible for analyzing situations, logical thinking, and impulse control, works less stably in someone who is ill. Stress weakens it even further. In practice, this means that a person with schizophrenia, under stress, loses access to the tools that make it possible to assess a situation calmly and realistically. Thoughts become chaotic, jump from topic to topic, concentration worsens, and the structure of the day begins to fall apart. This is not a matter of choice. It is the effect of biological overload. Third, the dopamine system, which plays a key role in schizophrenia, is particularly sensitive to stress. Raised dopamine levels increase agitation, anxiety, irritability, and the tendency to misinterpret events. This is why even minor tension can, in many people with schizophrenia, provoke symptoms that resemble the beginning of a relapse: poorer sleep, hypersensitivity to noise, social withdrawal, feeling easily hurt or on edge, and sometimes rigidity in thinking. If the stress persists, delusions or hallucinations may emerge, not because the illness has suddenly got worse, but because stress has disrupted the neurochemical balance of the brain. Fourth, people with schizophrenia have less psychological resilience to sudden change. They need a stable environment, predictable routines, calm relationships, and regular patterns of stimulation. Any abrupt change, conflict, noise, exhaustion, too much information, time pressure, haste, uncertainty affects them much more strongly than it would a person without the illness. For someone with schizophrenia, an overload of stimuli is not just uncomfortable, it is a real burden on the nervous system that can lead to disorganization in everyday functioning. Finally, people with schizophrenia have a reduced ability to recover after stress. A healthy nervous system returns to baseline after several minutes or a few hours. In someone who is ill, regaining balance takes much longer. Each episode of tension adds to the previous ones. As a result, small stressors throughout the week can accumulate and lead to symptoms that look like a sudden deterioration, when in reality they are the effect of a nervous system that has been gradually overloaded. All these mechanisms operate simultaneously. This is why stress in someone with schizophrenia does not just worsen their mood, it changes psychological functioning on many levels. And this is why it is so important that the person's environment is as calm and predictable as possible, without excessive or chaotic stimulation. Not because they can't cope with life, but because their brain reacts differently and needs conditions that do not trigger constant overload. Understanding this allows you to look at the person's symptoms with more empathy and realism. It is also the foundation for the next subsection, the one that concerns your own stress as a caregiver, because your nervous system is also affected by the constant tension of providing care. Stress in the caregiver's life. In caring for someone with a mental illness, most people focus on the patient. Their condition is the center of attention. Their symptoms require vigilance. Their safety seems paramount. Yet there is something that care systems are increasingly emphasizing, and that caregivers most often forget: if you collapse, the care system collapses with you. And for the person who is ill, this means immediate and very serious consequences, often hospitalization, crisis, or even a threat to life. This is why your psychological well-being, your physical health, and your ability to recharge are not a luxury. They are the foundation of care. Absolutely number one. Chronic stress affects a caregiver differently than it affects someone living without constant burden. It is not short-term stress that passes after a few days. It is long-term tension that the body gradually starts to treat as the new normal. In this state, cortisol, the stress hormone, remains elevated almost all the time. At first you may not notice it. People adapt to tension, they walk faster, think faster, react on autopilot. But over time a kind of fatigue appears that does not disappear after sleep. Irritability you can't control. A heaviness you feel in your bones. These are early signs that your nervous system is becoming exhausted. Long-term stress in a caregiver leads to something psychology calls caregiver burnout. This is a state in which a person still does everything that needs to be done, but does it without emotional engagement. They lose joy, stop feeling satisfaction, and eventually no longer have the strength or empathy that are essential in caring for someone in crisis. Numerous studies have shown that caregivers of people with mental disorders have the highest levels of burnout of all caregiving groups, higher than caregivers of people with dementia, autism, or cancer. This stems from the unpredictability of schizophrenia, the need for constant alertness, and the feeling of being responsible for the person's safety. Chronic stress also starts to take control of your body. Sleep problems appear, frequent awakenings, nightmares, difficulty falling asleep. Insomnia then leads to concentration problems, memory difficulties, irritability, and increased risk of depression. Over time, physical conditions may appear: high blood pressure, headaches, migraines, digestive problems, disturbances in heart rhythm, and even autoimmune diseases. This is not scaremongering. It is the well-documented effect of long-term stress. The human body is not designed to stay in a state of alarm for many months. Stress also affects your emotions. An overloaded person begins to react more strongly and more impulsively. They may feel hostility or anger towards the person they care for, even if they love them. They may feel resentment, helplessness, and sometimes even shame that they are not coping. These feelings are not proof of failure. They are a natural effect of a nervous system trying to protect you from further depletion. But if you do not respond at this stage, the caregiving system will begin to crack. You need to understand one thing: you are the pillar of the care system. The person who is ill cannot manage without you. You are their structure, their predictability, their safety. If your system collapses, the whole protective framework falls apart. And this is not a metaphor. In practice, it means crisis for the person who is ill, sudden hospitalization, psychotic symptoms, and risk to health and life. This is why modern schizophrenia guidelines stress very clearly that the caregiver's first duty is to look after their own mental health, not the patient. Because without you, there is no one to support them. If you are feeling tired, irritable, anxious, sleepless, emotionally numb, or increasingly fearful, these are not signals you can ignore. They are red warning lights from your body, telling you that your resources are running out. And if you do not take them seriously, your system will eventually switch off in the form of depression, a nervous breakdown, physical illness, or complete burnout. Your psychological comfort is the foundation. It is number one on the list of priorities. Not an add-on, not a luxury, not an optional extra. If you want to be an effective, stable, and supportive caregiver, you must first take care of yourself. Only then can you truly take care of the person who is ill. Summary. After reading this lesson, you should see stress in a completely different light. Not as a simple feeling of tension, not as an emotion that will pass, but as a real biological force that affects the brain, body, and behavior, yours and that of the person you care for. In medicine, stress is not a metaphor or an excuse. It is one of the main mechanisms that trigger and maintain both mental and physical illnesses. It changes how the brain works, disrupts cognitive processes, weakens immunity, and raises the risk of depression, anxiety, psychotic relapse, hypertension, diabetes, and sleep disorders. The most important part of this lesson, however, concerned the way stress acts on you as a caregiver. This is not ordinary tiredness. It is overload that builds up over months and years. Chronic stress leads to burnout, depression, anxiety disorders, physical problems, and the loss of your ability to respond calmly and appropriately. And this is not only about how you feel. It is about the fact that without your stability, the entire care system stops functioning. When you break down, the person who is ill is left without support. And that has dramatic, often immediate consequences. So you must remember one thing: your psychological well-being is not in second place. It is in first place. A stable caregiver means a more stable person with schizophrenia. A burnt-out caregiver means a high risk of crisis, relapse, or hospitalization. Your calm, your ability to rest, and your mental health are the most important therapeutic tools you have.